Hey, it's Mike Kearney.
And Deb Golden,
hosts of the Resilient Podcast.
You've been hearing a lot about the COVID crisis with Mike, and that's not going to change.
But we recognize you may also be looking for insights that can help you make decisions and take action as we emerge from the crisis.
As we come together to meet the challenges and embrace the opportunities crisis brings, we're going to be bringing more resilient content you've come to expect from us.
You'll still get the unfiltered leadership insights you've come to rely on from Resilient. Whether you're a new listener in the Confronting the COVID-19 series, or you've been with us from the beginning.
We hope you enjoy this episode on cyber topics. After all, cyber's everywhere. Technology is disrupting healthcare as we know it. Organizations and consumers are increasingly relying on technology and data to help them better manage health and well-being. And this shift to a new model of healthcare demands modern security solutions that are embedded into all processes, systems, and devices. It demands solutions that are flexible and scalable to manage the ever-growing ecosystem. Most importantly, it demands solutions that enable care rather than complicate it. Welcome to the Resilient Podcast, where we feature resilient leaders, real insights, and unfiltered stories. My name is Deb Golden, and I'm the U.S. leader of Deloitte Advisory's Cyber and Strategic Risk Practice. Today, we continue our cyber series with Adam Zoller, CISO of Providence St. Joseph Health, and I'm absolutely thrilled.
We're being targeted a lot more actively by cyber threat actors. And, I couldn't tell you if it's because there's more people working remotely necessarily, or if it's being driven by the COVID pandemic itself. Possibly opportunistic, possibly not, but certainly we've seen an uptick.
In this episode, Adam shares some of the challenges of managing cybersecurity in the healthcare industry. He also discusses how Providence is taking healthcare to the next level through their Health 2.0 initiative, how transparency, diversity, and ease of use can impact the success of cyber programs as well. I also enjoyed hearing how people are at the core of what Adam does every day, from being driven to an industry by the opportunity to impact people's lives, to his approach to managing cybersecurity through people, to hearing how he's leading teams through teamwork, inclusion, and mentorship. Adam truly is an admirable leader, and I'm so excited to share this episode with you. Tune in now for my conversation with Adam Zoller. So Adam, you've had quite a journey throughout your career, including the Army Reserve, consulting, working for the Department of Homeland Security, and across so many different industries. How did you end up at Providence St. Joseph's?
Yeah, great question. I like to say to my friends that, I'm coming full circle after 20 years moving back home. I originally grew up in Redmond, Washington, so it's nice to be back close to family and in the Pacific Northwest. I went to school out on the East Coast. After graduating college and going through training with the military, one of my buddies called me up and said, hey, you should come to Washington, D.C. You have a security clearance, you have Army communications experience, you could land a job pretty easily. And I thought, at the time I was skeptical and didn't really know what to think, I guess, in early 20s, but ended up taking him up on the offer, living on his couch for about a month, landed a role with what's now Department of Homeland Security's National Cybersecurity and Communications Integration Center. But back in the day, it was U.S. CERT, operating out of what was essentially a closet in Arlington, Virginia, a real small facility. We grew, we expanded, evolved, and I ended up doing a stint as a federal employee and then leaving the federal government side of the house, going to Booz Allen Hamilton, consulting for a little bit, led their internal cybersecurity incident response team, and then transitioned to a role with GE. I was in the GE family of businesses for about 5 years. And, after working at GE Healthcare for a period of time, I was looking for a new challenge, and just so happened that I got reached out to on LinkedIn by a recruiter at Providence St. Joseph Health. They were looking for a new CISO to complement their new CIO, and here I am. So it's been a heck of a journey, but I've been incredibly lucky to have great mentors along the way and people who really helped shepherd my career and give me great advice.
And if I heard also correctly, you've moved 5 times in the last 6 years to kind of support all of those changes and energy through your journey. Is that right?
I have, yeah. I've been incredibly mobile.
and with 2 young children, right? So with 2 young children.
Yeah, not every move with the 2 young children, but certainly been very mobile. And And yeah, if it's up to my wife and I, this is it. We're going to stay here in the Pacific Northwest, and I love working for Providence, so I'm planning on
Excellent.
sticking around.
Excellent on that. And a little bit more on your background. I mean, it seems like you've always had an affinity towards cyber threat intelligence. I always like to say I'm a cyber geek at heart myself. And so, is this a space you always wanted to work in? Did you wake up and say, this is what I want to do? Did you have some influence in your life that made you choose this path?
Yeah, it's funny. I graduated with a psychology degree from North Carolina, and I didn't ever really think I would make use of the psychology degree. People told me that, in order to make use of psychology, you're going to have to get a PhD and, open up a practice or something to that effect. But what I didn't realize at the time was national security intelligence, and specifically even cyber intelligence, is a very psychology dominated field. We're trying to get inside the minds of people who are conducting attacks against us and, preempt those attacks and, hopefully prevent some bad outcomes. So yeah, I didn't ever imagine that I would end up in intelligence or really cyber threat intelligence. The field didn't really exist when I started my career, but I was always interested in technology. I was that kid in high school and in college who was building his own computers. And the fact that I got the opportunity to work on technology and make use of my psychology degree, again, it's incredibly lucky and being in the right place at the right time, but creating some of that luck along the way.
No, and again, I think, incredibly astute when you think about your background and your college education and then how you've traversed your journey. And I think those two disciplines together probably are immensely valuable, not only to you and your teams, but also obviously when you're thinking about just even the subject of cyber with adversaries and others coming at it so many different ways. One other little pivot, if I might, again, if I understand correctly, you served over, I think it's 12 years in the U.S. Army Reserve as a captain. And so first, of course, thank you for your service. Similarly to your college background and your degree, how do you think that this amount of time and energy and focus as a captain in the U.S. Army Reserve has influenced your civilian career?
Well, it's certainly shaped who I am as an individual, and I wouldn't be where I'm at today without that military experience. I'm incredibly grateful for. Well, number one, I'm grateful for the support, and I really appreciate your support and all the support from all the people that I've received along the way being a veteran. Um, but certainly, I owe my entire career really to my military experience. It really started on the civilian side of the house with the security clearance that I was granted to do the work that I did in the U.S. military. And the training, I've been incredibly lucky again that the training that I've received, the work opportunities that I've received, the duties that I've received in the military and conducted in the military have been incredibly complementary to my civilian career. In the early parts of my career, I was second lieutenant, first lieutenant in the Army Reserves, serving in the 311 Signal Command. And there was a moment in time where they made a big pivot. They said, look, this cybersecurity problem is it's a big problem for the military. It's a big problem for the U.S. government. We have to invest heavily in it. We have to train our soldiers to be, the defenders of our nation's infrastructure. So, I benefited from that training. I benefited from that focus, but I also had my hands in some of the planning that really shaped and developed what's now the cyber security skill set for the U.S. Army and specifically for the U.S. Army Reserves. And exactly like you said, it's one of those experiences that really put me where I am today, and shaped me as an individual. I'd like to think that I was somewhat disciplined before I went in the military. My family will tell you otherwise, but certainly, learned discipline, learned how to organize my thoughts and tackle tough problems and think strategically.
All critical facets. So again, thank you for your service and hearing your journey and the influence it's had on your life and your career. And so with that, maybe we'll pivot a little bit into Providence. So you started that role recently. I think it was September of 2019. And so, how have you looked at this new phase in your career and really what would be, if you could say, this is what I want to achieve? I'm sure you've got goals set out for yourself and your teams, but what do you really want to put a stamp on?
Yeah, like you said, I'm relatively new at Providence. I started in September of last year, and right out the gate, I've been blessed to have a boss in BJ Moore who really has invested in this risk area, understands the risk area, understands the threat, and has really given me a lot of resources to bear to solve really some complex problems in the area as well. So right out the gate, what I did was I set out to understand, what are our current set of capabilities? What's our mission set? What's important to Providence, which is really, serving those who are poor and vulnerable, especially, but really providing a high level of care to our patients who step through the doors of our ministries and of our clinics and interact with our system in any number of ways. So it was clear that the overarching goal was to prepare for and help execute on this concept of Health 2.0, bringing care closer to the patients, no matter where they are in the world, no matter where they need it. Providence should be able to care for people and provide them a high level of service, whether they're in one of our acute care facilities or out in the field somewhere. So, on the cybersecurity side of the house, I had to analyze the capabilities that I had to bear and really position ourselves in a way that we could support that execution of Health 2.0. And what that meant was adopting more flexible solutions that are scalable, that protect our caregivers no matter where they are in the world. Things like proxy in the cloud technology, things like EDR technology, pushing defenses down to the host level and being less reliant on hairpinning traffic through our data centers. So just really a different level of flexibility and a different approach that had been taken in the past at Providence. Concurrently, BJ has a strategy of simplification, modernization, and innovation. And those three pillars play hand in hand with Health 2.0. The way I'm approaching that is simplifying our security technology stack, simplifying how our caregivers and how our patients interact with security, or simplifying how security rather interacts with them, which is in an ideal state very seamlessly and transparently. On the modernization front, it's ridding ourselves of technical debt. It's modernizing our capabilities and solutions to integrate things like modern threat intelligence so that we can move forward in the cyber threat kill chain and get closer to preventing attacks before they occur, or at least detecting attacks when they occur and preventing negative outcomes from them. And then on the innovation front, it's where feasible, innovate through security solutions to solve complex problems of the future. So solving problems around Internet of Things, clinical device security, and so on and so forth. Your last question around what do I see my lasting legacy being? In an ideal state, I'm doing a couple of things. One is setting a clear strategy, communicating that clear vision, and executing efficiently on that clear vision to make best use of Providence's resources so that Providence can really direct resources toward our core mission of serving the poor and the vulnerable and easing people's way. But also it's empowering the next generation of caregivers in cybersecurity so that, when I inevitably do move on, retire, or get hit by a bus, the next guy or gal in line is empowered and knows exactly what's going on and has all the skills and tools at their disposal to pick up the reins from where I left off and be just as effective, if not more effective than I was.
Well, it's always great to hear about the empowerment of others, and I'm sure you're teaching and learning along the way. And so appreciate you also creating the discipline, because it's not always there. So I appreciate you creating that discipline as others around you are learning. And like I said, you yourself are also doing the same. So one question I have, obviously we need to address the current situation that we're in right now, where we obviously have a pandemic underway, and certainly Providence has, been at the forefront of battling COVID, which is no doubt had a huge impact on you both personally and professionally, as it has me, the organization, the industry as a whole, I mean, the world as a whole. And so on the surface, when we think about crises like the pandemic or even a natural disaster may seemingly, not have a direct impact on cyber, I would of course say otherwise, because that's the world I live and breathe in. And so curious, how you and your teams, maybe not about specific threats, but just more broadly, how do you balance the growing demand for IT and cyber, throw on top of that a pandemic? At the same time, priorities and budgets seem to be getting slim. We know the cyber talent workforce is already stretched thin to begin with. And so, how do you help balance that? Are there any lessons perhaps that you can provide to the audience about, what to do in times of crisis, particularly in the area of cyber?
Yeah, absolutely. The COVID pandemic, I think, has created an incredible opportunity for us to accelerate some of the bodies of work that we already had in motion. Just speaking personally for my team, at Providence, we had some bodies of work in flight already through the Health 2.0 and simplification and modernization initiatives that were, pulling the security defenses away from a data center centric construct and into a flexible software as a service, cloud driven, cloud native delivery model. Some of those bodies of work that we had in flight, I think, saved us from some really negative outcomes when it came to the COVID pandemic. I mean, specifically looking at, we rolled out an EDR platform recently that gave us the ability to, on the network defense side, work remote, have our network defense team work remote, but still have the level of access that they needed and the level of protection that our caregivers needed, no matter where they were in the world. So, the fact that I'm working at home or my network defense leader and network defense team are working from home, that actually didn't change a whole lot, because we really pushed hard on driving some of this more flexible technology right out the gate. When it comes to the pandemic, though, you're absolutely right. I mean, there's a couple things that are really the most glaring impacts from this pandemic that hit our cybersecurity team. Number one was the level of exceptions that we were being levied on us from our business side of the house. And we had to be flexible as a cybersecurity organization, especially when it comes to granting some of these exceptions so that our caregivers could continue to provide care to our patients, despite the fact that they're working remotely. So, specifically thinking about one use case where some of our radiologists were working remotely and they needed to be able to view some images through a solution that they normally wouldn't have used to view imaging. We had to grant an exception so that they could access some systems remotely that we normally wouldn't have granted. At the same time, we had to look at our compensating controls environment and say, what makes sense from a compensating controls perspective so that this level of risk that we're accepting becomes manageable. So the COVID pandemic really pushed us to, I'd say, streamline our risk acceptance process, streamline our risk analysis process when it comes to IT risk, and streamline our exceptions process as well, and really partner a lot closer with the business on some of these ground level decisions that were being made, so that we could be flexible and agile. And frankly, as we saw COVID patients rolling through our doors and our capabilities, plussing up and surging, we also need to plus up and surge and support that. So there was that side. The other side is we're being targeted a lot more actively by cyber threat actors. And, I couldn't tell you if it's because there's more people working remotely necessarily, or if it's being driven by the COVID pandemic itself. But certainly we've seen an uptick in the spear phishing campaigns that we've faced. We've seen an uptick in the attempted ransomware campaigns that we faced. The types of attacks that we're seeing are growing in number, not necessarily growing in sophistication, but certainly targeting the healthcare industry as a whole. Possibly opportunistic, possibly not. But yes, to answer your question, it is impacting our cybersecurity organization. We're having to change our operating model quite a bit, and we're also seeing changes in the threat landscape as well.
And so, how do you think cyber leaders can implement change at the same time? Because obviously, I would suggest the pandemic has allowed us to have digital disruption or digital transformation in a matter of weeks and in a month or two versus months and a year. And so, knowing that business objectives are moving very quickly and knowing that change obviously needs to occur at a very rapid pace, sometimes, when people are rushing to make decisions to go to market, whether it be, for consumer use or otherwise, and sometimes I feel like cyber, might get pushed aside further than others in the rush to get to market. So I'm curious if there's anything from a culture of change or a people perspective where you think we could look to increase adoption across organizations.
Yeah, I think, what's helped me is I've had the benefit of having, some real strong champions in IT risk across our risk organization, across our IT organization, all the way up through, frankly, our CEO and our board level. They all understand, they get cybersecurity risk. They know it's a very serious challenge that we're facing. I have a great level of buy-in from really all of my core constituents when it comes to IT risk. So that is fantastic. And I think going into the pandemic, I know that people have my back, and it's a team fight. But to your point, when it comes to the partnership approach with the business and tackling some of the IT risks in the face of a pandemic, one thing that I've always, fallen back on is, typically when I'm engaging with the business directly, it's either cybersecurity communications and awareness. So, pretty benign, just raising awareness type activities, or it's a crisis. And during the crisis, I'm pretty much the most stressed out person on the phone, But during a pandemic, all of our physicians, all of our nurses, all of our clinicians, all of our leadership, they are facing a level of stress that I've never faced in my entire career. And so it's really grounding myself in the fact that this isn't a cybersecurity crisis that we're facing. This is a crisis of humanity, of health, that we're facing right now. And there are more important things than, combating the latest and greatest threat. It's keeping our systems available, keeping our workflows, our processes available for our caregivers to deliver care, no matter what the cost, to our patients who need care, no matter where they are and no matter what walk of life they're in. So I think, grounding myself in that mindset and understanding that there's more stress to go around in a healthcare system during a pandemic than there's room for.
Yeah, and on that point, and in terms of new technologies, as we think about and just being able to evolve with, to your point, that the healthcare landscape, if you will. Obviously, medical devices and new types of entrants, if you will, are continuing to be entrants. They've been around for some time, but as we've seen medical devices evolve and actually play a bigger role as we think about healthcare space, obviously there's another opportunity for cyber adversaries, and just the broader ecosystem of healthcare organizations continue to change and to grow, and I think will continue to do so. Do you have any specific areas where leaders might be able to glean benefits of how to adopt, particularly an Internet of Things mentality, when you think about the considerations that are needed and really how to stay on top of things like device security?
Yeah, this is a really challenging problem. These devices were oftentimes built and deployed with the understanding that they would be in an environment for, decades, not years. So a lot of these devices, are running operating systems that may or may not be within support. They may be proprietary operating systems. They may or may not be connected to your network. And who knows, the support construct for these devices, who knows exactly, from device to device. There could be great discrepancies between support for one device from one manufacturer versus another device from another manufacturer. There's a lot of vendors in this space that are making great strides to understanding the problem and partnering with organizations like Providence. Through those partnerships, we're tackling the problem, but it's a real challenge again. But really, step one is understanding your environment, understanding what your landscape is, what your attack surface is. And so, these devices, oftentimes you can't interrogate them directly, or you don't want to interrogate them directly because they're clinical devices and they might be serving patients. So, getting an accurate asset inventory is a challenge, but it's very doable using some key technologies or modern technologies that are out there. So getting an accurate inventory is step one. Step two is really understanding, what's the patch level, what's the landscape of what you're facing, and ingesting all that data into one central area where you can take action on it in a risk prioritized fashion. So in a sense, it's really no different than your enterprise environment. The challenge is, of course, being in your enterprise environment, you can interrogate devices directly. You can scan them for vulnerabilities and be pretty aggressive with that. You can install antivirus, anti-malware, EDR on those devices, and again, be pretty aggressive with how you respond to incidents. But if we have an incident affecting our clinical devices or a clinical device that's serving a patient, we don't necessarily want to quarantine that device. I think that would have catastrophic consequences. So again, the problem is not necessarily all that different from your traditional enterprise problem, but it requires a different approach to solve. And we haven't perfected it at Providence. It's one of the areas where I feel like we're potentially innovating, but again, we're partnering with some organizations that are on the cutting edge of thinking about this problem. And again, you can't solve this by yourself. You got to partner with your suppliers, partner with your vendors, partner with your internal teams, especially those that are out in the field, out in the clinics, out in the hospitals, and again, understand the problem and then come up with a game plan to solve it in a systematic fashion.
So, as we briefly touched on earlier, and even in the last response, you were talking about challenges around, people and finding talent and retaining talent. As we think about that, especially when we know that the landscape continues to change with IoT and medical devices and trying to stay on top of it. And candidly, if the environment's continuing to grow exponentially, I like to say cyber is everywhere. If it's truly going to grow even further, faster, farther, how do you build the right team to help support that? How do we look at retaining and finding the right talent?
That's the $1 million question. Finding people in cybersecurity is tough. Finding good, people who understand the mission, who are, motivated for the mission and stick around. Really, the retention problem is really tough as well. Finding the right team, I think, really comes down to, in my experience in cybersecurity, it's showing people that there's a tough challenge that needs to be solved. If I've learned anything in my career, it's that people want to work, especially in IT and cybersecurity. People want to work for organizations that have real world challenges where they feel like they're making a difference. Because cybersecurity talent, we have negative unemployment in cybersecurity. Our people could work anywhere, and they could probably, frankly, work anywhere for more. So the challenge is, keeping people engaged, keeping people, learning and investing in them from an education perspective, but keeping them most of all challenged and focused on problems that actually matter. Being a triage analyst is a tough job. It's not a tough job because of the technical content of the work itself. It's a tough job because, it's a point and click eyes on glass exercise. But there's so much more that triage analysts can do if leadership would just allow them to do it. So again, it's plugging them into challenges where they feel like they're learning, where they feel like they're engaged with the mission, and where they feel like they're making a difference. And luckily with Providence, this was one of the things that attracted me to Providence in the first place was, we have a phenomenal mission, serving people in their time of need, providing people with the medical care that they need, and especially during a pandemic. I mean, we're truly on the front line of providing care during the pandemic. So attracting people with the mission has been relatively simple. And then it's just, a matter of, from a retention perspective, staying engaged, communicating actively, being candid and authentic as a leader, knowing that people, letting people know that you have their back and that you're looking out for their best interest is just absolutely crucial. And being available for people to talk to is also crucial.
Authentic leadership is one that I hone in on a lot, because that's something that's incredibly important, and I think it takes some time. I mean, from a maturity perspective, to understand the value of being an authentic leader, and I tend to believe that means you're also an aspirational leader, likely. Just when you think about being able to bring your life's journey and being vulnerable enough to be authentic about that leadership, I think is critical to not only building a team, but to the point you made about retaining the talent, because I think that's equally as challenging, particularly to your point in this market. We could probably work anywhere. And so making sure that you're retaining talent that's going to have the opportunity to lead and grow at the same time, feel empowered and aspired to, is quite phenomenal.
Absolutely. Yeah. And, attracting the right team for the task is a challenge as well. Frankly, one of the underpinnings of any successful team is diversity. It's diversity in thought, diversity in background, diversity in approach, which comes with hiring diverse candidates. Cybersecurity is a very homogenous field. We really need to invest more, I think, and attract more talent to cybersecurity from people with diverse backgrounds, people of color, people of different ethnicities. Women in cybersecurity is big. So, it's attracting the right team for the problem, attracting a diverse team, and then retaining that team, and keeping people engaged and growing the organization together. It's the $1 million question. If anyone solves it, please let me know.
Yeah, no, and I do think, I mean, the diversity in candidates and thinking, based on diversity of all things, I think is incredibly important, because when you think about the complexity of cyber problems that we're trying to solve, we need that diversity. If we had one mindset and one type and one example, we would never solve for and think about things as differently as we need to, particularly in the world of cybersecurity and the complexity of the problem. So I again, couldn't agree with you more. on that topic and the need for us to be able to do more in that capacity around building more diverse teams, more diverse approaches, and candidly, more diverse capabilities to be able to drive towards solving these very complex problems. So, completely agree with you.
Yeah.
All right, we're going to shift to the last part of our podcast. I like to say it's my favorite part. Whatever first comes to mind, a sentence, a minute, a word, a couple sentences, whatever works. The first one I'll ask you is, what does it mean to you to be a resilient leader?
Well, that's a loaded question. I don't know if I can answer that in rapid fire fashion, but I'll try. Well, to me, it means, investing in the next generation of leadership. It's leading in, well, it's really two things. It's leading in a way where people can emulate my leadership style and be successful, that I'm holding people to the same standard that I hold myself to, and that I'm grooming the next generation so that when I eventually, get promoted, move on, whatever happens, that next generation can step in and maintain organizational resiliency or capability resiliency.
From what I understand, your leadership style is very human focused. Obviously, we've been talking about people, culture. You've mentioned being an authentic leader. What exactly, if you were to say, here's, the I wouldn't say the best or the number one, but some other attribute about your leadership style that makes you the most effective leader?
Yeah, I think it is a very human problem. Cybersecurity. It has technical aspects as well as the human aspects, but ultimately, it's people sitting behind keyboards that are doing things that you're either trying to prevent or encourage. So, me as a leader, to tie back to the human element, it's number one, understanding the human elements of how to defend a network, and the human elements of how to influence and how to lead. But it's relating to people at a personal level. Being able to attract and motivate and inspire and connect with a team that really is carrying the brunt of the burden. I'm not the one that's sitting there and defending our network every day, hands on keyboard, kicking bad guys out of the network. That's my team. I hire the best people for the job. I retain, hopefully, the best people for the job. I'm just the leader. So it's connecting with the people who are doing the tough work, and connecting with them, motivating them, keeping them inspired, and engaging with them in a way where they know that I have their best interests at heart.
And I'm sure they're very appreciative of that, particularly, knowing you've got their backs, because that means a lot for your talent and for those around you as well. All right, two more. So I understand you believe in making your own luck. What exactly does that mean to you?
Yeah, I have been incredibly lucky in my career, and I say I make people make their own luck as well. And I think it's elements of putting yourself in the right place at the right time so that you can realize opportunity. So for me, it was, positioning myself, taking a bit of a risk, moving up to Washington, D.C., despite having no family there, and taking a risk, not having a job and burning through my bank account pretty quickly, understanding that, that's where I would have the best opportunity for my career. The other piece is, continuing through with my military career. I volunteered. We have a volunteer force, the military, but volunteering for that service and sending myself into harm's way, created a situation where I could learn from the best and brightest, and absorb really some practices that I've implemented throughout my career. So, yeah, I think when I say make your own luck, it's about positioning yourself through training, through frankly geographical positioning, through connections that you make, but then also really seeking out and building mentor-mentee relationships with people that you admire and people that you trust. And it's greatly simplified down into quote unquote make your own luck, but at the end of the day, it's really positioning yourself for success and positioning those around you for success as well, because you never know who you're going to end up working for.
Amazing, amazing stuff. And so I'm going to wrap it up with one last question. Obviously, really enjoyed the conversation. I was taking notes with my Sharpie, as all the listeners know who have listened before. I often take notes and with my Sharpie so I can reflect back as I think through these conversations. And so, one thing to wrap us up again, this one stumps people too, not intended to, but one final question: how would you describe your brand?
My brand. That's a really tough question. I'd say engaging, and personable. I know that didn't sound very definitive when I said it, but
no,
I like
but
to think that I'm personable and that I'm reasonable. I tend to be a bit overly pragmatic sometimes, but in a risk field, sometimes you have to be pragmatic and take emotion out of the situation. So I can be cool in a fire, and sometimes I've received the feedback that I'm a little bit too cool in the fire, but I'd say engaging and personable, hopefully.
I feel that genuinely from you, and certainly appreciate your candor with me today. So again, thank you so much for being here, Adam. I truly appreciate it.
Thank you, Deb. I really appreciated the conversation and the time. Been great talking to you.
Thank you again, Adam, for your time today. I thoroughly enjoyed our conversation and learning more about your journey and your authentic leadership style, as well as the challenges faced within the cybersecurity landscape, not to mention your passion for the mission and making your own luck. If you like what you heard today, stay tuned for more discussions with cyber leaders as we continue our cyber series, and to hear from some new hosts as we expand the podcast to also feature chief audit executives, chief risk officers, and many others. Check out additional episodes on your favorite podcast channel and subscribe to our podcast at Deloitte.com/US/resilient. And feel free to connect with me on Twitter at Golden Hokie. That's GO1DENHOKIE. Thank you so much for listening.